Do you have neck pain, mid-back pain, or lower back pain that is a lot worse with activity or sitting or standing for a long period of time? It gets better if you rest or lay down. Today we're going to be talking about facet pain syndrome. The facet joint is a small joint that extends the length of the spinal column from the bottom of the spine all the way down to the skull. The joint is covered by a capsule supplied by a tiny nerve called the dorsal median branch that comes off the nerve root and supplies the joint, takes the pain signal from the joint and supplies the muscle on top of the joint. People who are affected by this syndrome usually from excessive use. So for the neck, usually people who use the computer excessively, architects or teachers. For the lower back, people who sit or stand for a long period of time, such as drivers. Also, you can see it after trauma, after an accident, it gets irritation of the facet joints causing the symptoms. So the symptoms usually described as severe pain on top of the affected joint with muscle spasm. The pain is a lot worse with activity, sitting or standing for a long period of time. It gets better when you rest or lay down. For the neck, the pain usually extends to the shoulders. Rarely the pain will extend to the extremities or cause numbness or tingling sensation of the extremities. The diagnosis is based on a clinical history. We ask the patient what they do for a living, if it's from excessive use or if they had trauma. On examination, they'll have severe tenderness on palpation over the facet joints. There will be also limitation in range of motion of the spine or the affected area. At times, we might order an x-ray that can show the spasm or straining of the spine. It can also show arthritis of the facet joints. At times, we might order an MRI of the spine or the affected area or CT that can help us with the diagnosis. But typically, we rely on the history and the clinical examination. So the treatment will start with conservative therapy. Conservative therapy starts with rest when the pain is severe. We also use muscle relaxant, anti-inflammatory, and physical therapy. We ask the patient to go to the gym and exercise the spine to strengthen the spine, so to prevent the recurrence of the symptoms, as this is an excessive use, so you will continue to have degeneration and flare-ups. So if you exercise, you lessen the frequency of the recurrence of the symptoms. Now, if this fails, then we go to intervention. We use injections. So under fluoroscopy, we advance a needle and get to the joint. We inject the joint itself or the capsule, and at times we block the nerve or the dorsal median branch that supplies the joint. We use either steroids with anesthetics, or we can use platelet-rich plasma. Rarely we use a stem cell. Also, at times we use radiofrequency to burn the nerve that supplies the joint, therefore prevent the pain signal going from the joint, and the pain goes away for about 1 year to 2 years. But we rely on conservative therapy first and exercise to strengthen the spine and prevent the recurrence of the symptoms. Thank you.